Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. That's 866-870-5752. Remember to check the website at www.lastemcells.com. That's lastemcells.com. And we're going to talk to Grant in Ventura.
Hey, Grant, Dr. Marc Darrow, how are you today?
How are you doing, sir?
How long has your left knee bothered you?
It's been going on about 2 years. I've got a couple of shots, cortisone or whatever.
Sure.
But they keeps on coming back.
Okay.
I've had an MRI, and it's they say it's a tricompartmental
arthritis. Yeah, osteoarthritis.
Arthritis, and with a lateral tear in the meniscus in my knee.
Yeah.
So I've got a tear already, and it's lengthwise. It's not cross section. So
sure.
So they want to do a knee replacement. So the whole chromium and I've been a house painter for most of my life. I'm retired now.
Okay.
So I was on my knees a lot, but I'm concerned, because I've had a lot of operations, fusions in my back, a fused foot because I fell off the ladder and all that. But this operation here kind of scares me because I don't know what the MRI says. Moderate to severe tricompartmental osteoporosis and a torn inner meniscus.
I got it. May I speak?
Sure. I'm sorry.
All right, good. No problem. How old are you, Grant?
I'm 66.
Okay, so you're young, and I'm going to talk just generally about knee replacements and arthritis and what the efficacy is of them and the need for them. So most people that come in with knees like yours, if you can bend it, can you bend your left knee?
Yeah, well, with a shot now, I'm not feeling it as much, but before it was wanting to, what do they call it? It just wouldn't open up. It would.
I'm asking you a simple question, though, not a big answer. Is it,
sure.
Can you move your knee? Can you walk?
Yes.
Okay.
Yes, but that's what the shot I had about a few weeks back would take 2 weeks for. But before then, there was a lot of pain on the.
Okay. Let me speak a little bit, Grant. Okay.
Sure.
So, most people like you, we can help get better, and you would probably need a series of platelet and stem cell injections. I generally do it once every couple of weeks, and then we want to keep the inflammation going and get you healed up as quick as we can. Some people do these injections, say, once every 3 months or even longer because they're waiting for the total effect of it. But in my experience, and I think I do more than anybody else on the planet, I'm not sure, in my experience over 20 plus years, the more frequently you do it, the faster you heal. And I had a gentleman fly up from Georgia who stayed here for 5 days, and I injected his knee, which was very similar to yours, by the way. I injected it 3 times in 1 week, and I hear from him occasionally, and he says his knee is perfect. So I'm not telling you you're going to get better. I can't promise anybody anything. Medicine is not a promising game. But I would not do a knee replacement if it was me. At 66, if it comes out okay, you're probably going to have to get it replaced again. And the problem with that is the metal that is put into the bone wears away the bone, and then there's a bigger hole in the bone, and then how do you put a bigger piece of metal in there? I've had cases with patients where they've done that and the bone cracks, and we've had to amputate. So I am not a person for doing any knee replacement unless that knee is crushed and you've got to do it. A knee like yours to me, is not so bad. And I laugh every single day when people come in saying they need a knee replacement, and I examine their knee and I say, "You've got a great knee." And I laugh, and they go, "Why are you laughing?" And I go, "Because you don't need any surgery. Our culture is surgical."
What about the torn meniscus? What about
piece of cake. Piece of cake. Yeah, we treat those all day long. Arthritis, and it doesn't matter what it is, because, I started out the show by talking about how you can't look at your MRI to decide if you have pain. Because when we do studies of people that have zero pain, guess what we see? Guess.
What's that?
All kinds of stuff.
Yeah.
And we go, whoa, you don't have pain, you should. You've got a meniscal tear, you've got arthritis. So don't believe your MRI in terms of...
Well, I'm just saying before the shot, I said, I might walk out of this office unless I get a shot because the surgery is scheduled for March 17th. I'm saying, I can't...
Well, look, if you're gonna get a knee replacement, it doesn't matter how many cortisone shots you get, because that stuff is going to destroy the cartilage that's left in there.
That's
so
what
who cares?
That's what I heard.
That's going to be amputated. You're going to throw it away. Who cares if it's any good or not? But if you're the guy who doesn't want surgery, don't get cortisone. Do you understand that? Do you understand the concept?
That's what I heard about that. Solutions can eat away at the... Does the stem cells help with the rebuilding of cartilage? Or
Absolutely. The platelets and the stem cells together would be used most likely in a case like yours. The platelets are good, but when you add the stem cells to it, it's even better. So that's what I would want to do with you. Your surgery is scheduled in March. We got plenty of time to get you better, Grant, before March.
Yeah, they said that my cortisone shot that I got, they said they could only do it with a certain time frame because of surgery infection. It has to be out of there. I don't know what that means, but
what it means is simple. When you take a cortisone shot, you can get an infection from it. Okay.
Right.
So if you don't want to do a surgery, you don't want to do a surgery after a cortisone injection. You can come in after a cortisone injection, and I can, maybe a week after the shot, I can do my procedures on you and get you healed up. But
you see, there are no, you don't. Then I will call. I got your website and everything like that.
Let me just give out the number for everybody else. It's 800-300-9300, 1-800-300-9300. That's the office. And there are people by the phones right now. If they don't pick up, just leave your phone number. They'll call you right back today and give you more information. Anyone else who wants to call the show right now and talk to me, the studio number is 866-870-5752. That's 866-870-5752. So, Grant, I think I got you covered here.
Yep, sir.
So I'm going to move on. I just want
Thank you, Grant.
I want to mention that people that call into the show get a free copy of my book, which is on stem cell and platelet therapy. The byline is so important. It says regenerate, don't operate. And Grant, that's what we'd want to do with you. We want to regenerate the cartilage. And for other people, it could be ligaments or tendons, muscle, whatever it is, instead of operating on it. This book has about 256 studies that will show you that you don't want to get surgery. They don't work out that well. Back in the day, that was the culture of medicine. It is changing quickly, and I think you ought to get on the regeneration train instead of the surgery train if you have an option. If it's an emergency, go get the surgery. But then, of course, what is an emergency? The surgeon's opinion and my opinion are always different. So come on down.
Absolutely. So the number again is 866-870-5752. Remember, we are here Saturdays at 10 a.m. and at 1 p.m., and we're going to Steve in Pico Rivera.
Hey, Steve, Dr. Marc Darrow, I just want to say something before we talk. Suzanne Summers, one of my favorite people on the planet, and a real advocate for regenerative medicine, stem cells, and all of these wonderful things that other doctors are just starting to learn about. I just came out with a brand new book. It's called A New Way to Age, and you can get it on Amazon, and there is a entire chapter on me doing regenerative medicine in it, so you can read her words about the efficacy of using these treatments that I do. So God bless you, Suzanne Summers. You do great work in spearheading the changes of medicine that have to come up. It's time to get out of the dinosaur age of medicine and move into the future. And Suzanne, you are one of the people on the planet who is helping all of us do that. So thank you so much for doing a chapter on me and the stem cell work and platelet work that I do. Your new book, it's called A New Way to Age, and people can get it on Amazon.com right this minute if they like.
Excellent.
You didn't know that, Nita, did you?
I suspected, because it seems like you can buy the world on Amazon.
That's true.
Not your treatments, though. They have to go see you. And the office is 800-300-9300 if you're ready to make your appointment. But we're going to circle back to Steve in Pico Rivera.
Steve, Dr. Marc Darrow, both your legs hurt. What does that mean, your legs?
Hey, Steve, are you there?
All right. Yes, copy. Can you hear me?
Yeah, a little louder, please. And Dr. Darrow just asked you about what's going on with your legs.
Yes. My legs, I've been a strong walker all my life. And the last couple of years, maybe 2.5 years, it seemed like in my job, what I do a lot of walking, anywhere from 5 to 10 miles a day. And my legs are cramping up on me after about 5 and 10 minutes of walking.
Okay.
So much so that I have to stop and rest about 5 or 6 minutes, and then I can go again. But
okay.
It's really becoming a hassle. I mean, it's from my upper thighs all the way to my heels. Well, not my heels, but my ankles.
Okay. So
let
me give you some information right away, and you can write this down.
Go.
What I would do is I would start taking potassium, magnesium, and calcium, and make sure you're hydrated, because the cramps can come from an electrolyte deficiency. Now, what is your age, Steve?
68.
Okay. So as we age, we dehydrate. Kidneys don't work as well. Things just don't work as well. And you may need to carry some water around with you. But you've got to get the electrolytes. So potassium, magnesium, calcium may be the very immediate answer to your problem. I would have to examine you, and there's a possibility you could have spinal stenosis causing this. Have you ever had any back pain?
Well, depending on the jobs that I'm doing in a particular day, sometimes I do, but generally I don't have a lot of back pain.
So no one has thought of doing an MRI of your back to see if you have spinal stenosis, but I wouldn't jump to that. I would just jump to picking up, go to the health food store, pick up potassium, magnesium, calcium, Whole Foods or anywhere you want like that, and try it. That's an easy solution if that's the problem. Do you get it?
Okay, what is the best absorbable form of calcium that I can get? Because I understand some calcium doesn't absorb.
I wouldn't worry about that at this point. Just try a good quality. Don't get the cheap stuff. Don't get cheap stuff off the internet. You get what you pay for. It's like going into a restaurant ordering a steak. If you pay $5 for a steak, it's going to taste too good and it's going to be hard. So it's the same thing with supplements and vitamins.
I've heard some people say that because I'm a vegetarian, I don't eat meat, that might have something to do with it.
It might, but it may not. So I say the first step, the simple way, the conservative way, is try some electrolytes. Okay?
Okay.
If that doesn't go away,
Calcium,
then yeah, potassium, calcium, magnesium, those three, and lots of fluid intake, and see if that helps. And if not, then call my office at 800-300-9300 and set up an appointment. Come in, and I'll examine you and see if I can find the cause of this. You can also, if you like, go to the website at www.lastemcells.com. I'll repeat it for you, www.lastemcells.com. And you can email me a question from any page, and you and I will hook up and figure this thing out, okay? There is an answer.
Hey, sounds great, sir.
Thank you, Steve.
And it's
Appreciate
amazing.
your call.
You're a lucky man to walk 5 to 10 miles a day. Most people don't get off their assets.
I don't have a choice at my income level.
Thank you.
Okay. Very good, sir. Thank you. Thank you.
God bless you, man.
You're welcome. Feel better. Our number is 866-870-5752, and we're going to Mike in Oak Park.
Hey, Mike.
I did. Yes.
Mike,
yes.
you're with us.
Yes.
Mike?
How can I help you? Is this Dr. Darrow?
Yeah, how can you help me? That's
In the
good.
flesh.
I'm so sorry, sir. I was talking to another person. All my attention is on you. I didn't expect you to answer so quickly, but thank you.
You're welcome.
Sir, I have a couple of problems. Before I heard your program, I had the medial meniscus of both of my knees replaced. You know, the piece of titanium and plastic. And the right one, which I had done about 12 years ago, was beautiful, but the left one has been giving me nothing but pain. And before I make a mistake and do a whole knee replacement, especially after hearing your story about how the bone splits, I wanted to possibly talk to you and see if I can be helped with stem cell or your platelets, and people that have gone to you just rave about it.
Well, thank
and
you
that
so
their
much.
pain is gone. So,
Do you have half,
and I
do you have
also
half
have
the knee that's still natural?
yes, sir. Yes,
Then
I do. On the
then we can-
lateral,
Yeah, we
all
can
I
help
guess
you
all
then.
my ligaments are all still there.
Yeah, we can probably help you.
normal.
If you just had a half knee replacement, then we can probably still help you.
That would be awesome. So, and then the last thing is I've got like really bad hammer toe on my right toe. It's fused together from arthritis. It's in my family. And I was going to see if maybe you could help that before I try to have surgical procedures done on it. But it's actually rubbing into my second toe pretty heavy. I put spacers in there to try to keep it from getting worse.
Yeah, I probably cannot help you with that.
Work that well.
Probably can't help if it's
Okay,
fused and it's digging into the other toe. That might be something you need to get surgery for. My advice for you for that is go to the number one surgeon that you can find, and you can email me, and I can talk to you about that. I don't want to badmouth anybody, and
I get it.
I want to send you to the best. And toes and fingers come out weird with some surgeons.
Okay.
So
even with the stem cell treatments.
No, I'm talking about with surgery.
Oh, I see. Okay.
Yeah.
And but once you get them fused like that from arthritis, you can't do a lot for.
No, I'm not saying I
for a
can't.
patient.
I mean, if you came in for your knee, I would probably treat your toes for free.
You're a great guy, sir.
I try
I'll tell
to
you.
be.
All right, I'll make an appointment. I got your number, the 9300 number. I will make an appointment, and I look forward to meeting you. Thank you.
All right, just for everybody else and for yourself here, the website is www.lastemcells.com, and you can email me from any page there. And Mike, we can start talking through the email. And for those
You're an
of you
awesome man, sir. Thanks for helping all the people you do.
God
Thank
bless,
you.
man. Appreciate it. And for the people that want to call into the office, it's 800-300-9300.
All righty. Let's go to Cynthia.
Cynthia, how are you? You've got osteoporosis. Can I help you? Yes.
Oh, okay.
That's the short answer. How old are you, Cynthia?
I'm going to be 66 in January.
Okay. And let me ask this. You haven't been on hormones, natural hormones, I take it, right?
No, I've taken Fosamax off and on for maybe about 5 years, and I do some yoga and some weight-bearing exercise. And so I've gained a little bit of bone, but not really enough. And it's been advised that, you can take Fosamax for 5 years, and now they're leading me toward Prolia. But I don't know. I'm should exercise more. I'm a slight build, and I just, am kind of not getting that much better. So I was just wondering if any of your treatment is helpful.
Well, the treatment that I'm going to tell you about it's gonna shock you. All right?
Oh, okay.
Number one, when you take Fosamax, you have more bone because it blocks what are called the osteoclasts, which are cells that cut out the old bone. So you end up with more bone. Guess how good that bone is? I don't hear you guessing.
Oh,
come on, Cynthia. You
no,
can
I mean
do it.
I've heard that when you take Fosamax, it does not allow your old bone to kind of slough off. You just have a layering of bone, which sometimes
That's right.
is
So when you get a
not,
bone density
not
done,
as strong.
it looks better, but it's worse. And there are proximal femur fractures in people that take these drugs, like Fosamax and Prolia. So I would stay away from them. And if it were me in your shoes and in your bones, I would be using hormones. That's what remodels the bones. Personally, I've been injecting testosterone for probably 25 or 30 years. Why? I lost mine pretty young, and I had not osteoporosis, but close to it. And I have seen people that I supplement hormones with gain all of their bone back. And that's real bone.
Oh.
That's not the dead bone.
That's interesting. What kind of I guess I would have to see you to see what kind of treatment program you would suggest. And
well, for a woman,
it's
it's simple. It's just you use a cream of estrogen, and you take progesterone by mouth before you go to sleep because it puts you to sleep really well. And then testosterone you use as a cream. And you need all three of those.
When I was younger, maybe in my 40s, I think I took estrogen and progesterone together for a short time. But
so sorry, I have to cut you off, Cynthia. We are completely out of time. Thank you, Dr. Darrow. Thank you, Alex and Suzette, and everyone behind the scenes at Living Pain Free. Grab a pen or a pencil, write down this important information coming your way, and remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens, and we'll see you next time.